Thank you for entrusting us with your care at Community Center for Joint Health. Community Center for Joint Health is a dedicated program for hip and knee joint replacement that began in 2008. We have specialized orthopedic surgeons, nurses, and physical and occupational therapists who are committed to getting you back to the life you deserve. The goal for your surgery is to relieve pain, restore independence, and return to an active lifestyle. Preparing for your surgery ahead of time will assist you in having a successful recovery. I am one of the dedicated joint care coordinators that is a part of your care team, and over the next several minutes, we will discuss how to prepare for your surgery, what to expect during your hospital stay, discharge planning, follow-up after your surgery. Prior to your surgery, you will receive a guidebook from either your surgeon's office, pre-operative clinic, or your joint care coordinator. The guidebook is yours to keep and is designed to provide education for you and those family members or friends who will assist you during your recovery. Please take time to review it prior to your surgery. Remember, this book is just a guide. Based on your individual needs, your physician, physician's assistant, nurses, case manager, or therapist may add or change any of the recommendations. Always use their recommendations first and ask questions if you are unsure of any information. There may also be additional handouts provided along with the guidebook that will give you more details that are specific to your community hospital site and physicians. Your guidebook also has a copy of the exercises you need to begin doing prior to your surgery. Please refer to the Center for Joint Health pre-surgery exercises of hip and knee video that goes through these exercises with you. Although the potential complications and the interventions to prevent these are listed in your guidebook, I encourage you to watch the separate Center for Joint Health complications video that addresses these. Once your surgery is scheduled, it is important to talk to your family and friends to see who will be available to help you out at home for the first week or two after you are discharged from the hospital. The first couple of days at home, it is important that you have someone there with you 24 hours. They can assist you not only with some of your basic needs, like getting your meals, but can also keep you on track, motivated, and honest with your recovery. We invite and encourage a family member or friend, as we like to call them your coach, to be present during your stay in the hospital so that they may watch and participate in your therapy session. They will learn how to best help you stay safe during your recovery. You will be notified by your surgeon's office and/or the surgery department of a preoperative clinic appointment that you must attend approximately 2 to 3 weeks prior to your surgery. The purpose behind the visit is to medically clear you for your surgery and will entail blood draw, urine sample to check for infection, MRSA, methicillin-resistant Staph aureus, nasal swab, possible EKG and/or an X-ray, may go over your consents as well. Visit from the hospitalist or the medical doctor to go over your health history and give you instructions regarding your home medications. Provide you with special antimicrobial and antibiotic cleanser to use prior to your surgery. Inform you of the most up-to-date visitation policy. The doctor may require you to get cardiac clearance from your cardiologist if you have one. The special antimicrobial and antibacterial cleanser you receive during your pre-op visit is important to wash with prior to your surgery. It will help decrease germs that naturally occur on your skin and reduce the chance of getting infection. You will receive a handout that instructs you how to and how often to wash with this cleanser. Most important to note is, do not use this cleanser on your face or your lower private areas, so make sure you use your own shampoo, face wash, and soap for these areas. Gently wash with this cleanser for 5 minutes. Pay most attention to the surgical area. Do not wash with your own soap right after using the cleanser. Do not apply lotion, cream, or ointment. You may wear deodorant. Call your surgeon's office before your surgery if you experience flu-like symptoms, respiratory or breathing issues, fall and have an open wound, infections or cuts, rashes, a fever. You do not want to be actively sick or have an open area that could lead to infection. As you prepare for your surgery, do some basic things to keep yourself healthy. 2 weeks before surgery, increase your hydrating intake, like water, unless you have a fluid restriction due to another medical condition. Eat a well-balanced diet of protein, fruits, vegetables, and fiber. Protein is especially important in your daily diet before and after your surgery to assist with good healing. Get plenty of good rest. Wash your hands throughout the day, using soap with warm water for 20 seconds, getting your nails and between your fingers. Before you have your surgery, it is a good idea to do some things in your home to make you more safe and comfortable as you recover. Some things to consider are basic house cleaning and laundry, meal planning, cook ahead, buy pre-made options, frozen meals, healthy snacks, etc. Safety measures. Pick up throw rugs the walker can easily catch on and be a trip hazard. Clear clutter and cords out of the walkways, use night lights, etc. Bathroom safety. You may need a toilet seat riser if you have a low commode, safety bars in the shower, or non-adhesive strips on the shower tub floor. A shower chair may be needed. Pet care. Don't forget to make sure you have assistance in safely caring for your pets while you are recovering. Set up a recovery area. It is important to spend time sitting up throughout the day with your legs elevated to help keep swelling managed. That is normal with your healing. A recliner or comfortable chair or couch with an ottoman to have your legs elevated to hip height will be best. The day before your surgery, you want to make sure you know what time you need to be at the hospital the next day and where you need to enter. You will receive a call from your physician's office or the pre-operative clinic verifying your time and location at the hospital to come to the next day. Make sure you shower with the cleanser as instructed and have had a bowel movement that day or the day before. After midnight, you will not be able to drink or eat anything, which includes chewing gum, sucking on candy, or smoking in preparation for your surgery. The only exception is taking the medication you were instructed to take during your clinic appointment. In that case, use just small sips of water when taking the approved medication. Do not shave your legs in preparation for your surgery. That will be done by the nurses on the day of your surgery. You will also want to have a small bag of personal items ready to go with you to the hospital. To make your stay more comfortable, we recommend you pack a small bag of personal items including 1 to 2 comfortable, loose-fitting outfits like shorts, sweat or lounge pants, t-shirt, a long sleeve option, supportive shoes, etc. For those having knee replacement, make sure any pants you bring are loose enough to come up over your knee. Getting dressed in your own clothes the morning after your surgery will help you feel better when you are working with therapy. Items for downtime like cell phone, iPad, chargers, book, crossword puzzle, etc. Personal items, glasses, dentures, hearing aids and cases to store them, deodorant, toothbrush and toothpaste, etc. CPAP if you have one. You can leave your distilled water at home. Walker if you have one. Leave your medications at home. We will provide those to you while you are here. If having surgery in the surgery center, you go home on the day of your surgery and do not need an overnight bag, but need your home meds, walker, and CPAP. Leave your things in your car until you have a room after your surgery. Then your family or friends can bring it to you afterwards. When you report to the designated area on the day of your surgery, you will be checked in and taken back to a room in the preoperative surgery area. There, you will be given a gown to change into before your consents are verified, and you are given a hospital bracelet to wear with your name and birthday on it. An important part of your safety is that we verify your name and birthday before medication is given, a treatment is started, etc. The nurse will get you ready for surgery by starting an IV for fluid and medication during your surgery and recovery. Begin monitoring your vital signs, like your blood pressure, temperature, heart rate, breathing rate, and oxygen level. They will also clean the surgical area and shave it to prepare for surgery. In addition, we have you use a nasal ointment to help protect from bacteria. Your surgeon will meet with you prior to surgery to answer last-minute questions and mark your leg for surgery. You will also get to meet your anesthesiologist, who will go over the plan for your anesthesia with your surgery. After your surgery, you will spend some time in the post-anesthesia recovery area, where the staff will closely monitor you while you wake up from your surgery. You will be able to eat and drink as you wake up. We will have you start slowly with ice chips, water, broth, and jello to make sure you don't feel nauseous and you are swallowing well. Most patients are eating a regular meal that day of your surgery. We will give you instructions on how to order your meal, or we can assist you. In order to help you stay moving and comfortable after your surgery, we utilize a 0 to 10 pain scale, with 0 representing no pain and 10 indicating your pain is out of control. Utilizing the scale, you can indicate how you would rate your pain, which will assist us in administering appropriate interventions. It is important to set realistic expectations regarding your discomfort and pain after your surgery. Understanding how you would describe your joint pain before surgery and knowing that although your surgeon has addressed the cause of your pain, setting 0 as your goal is unrealistic. There will be some discomfort or pain early on in your recovery from the surgery itself. However, with the interventions, it should be manageable so you can walk and do the important exercises. We utilize multiple interventions together to keep you comfortable and moving after your surgery. It starts with your anesthesiologist and surgeon. Your anesthesiologist may administer a nerve block after you are sedated that specifically targets the nerve pathway by your surgical site. Your surgeon may order specific medications prior to your surgery and administer other treatments to the surgical area itself to help with pain control. Both your surgeon and anesthesiologist will explain their interventions to you prior to surgery. After your surgeon will order pain medication that you will continue to take at home for a short amount of time. It is important to take this medication with some food and track when you take it to assist in lining it up with your therapy. Taking the medication 30 to 45 minutes prior to doing your exercises will help you be more comfortable and have a productive therapy session. If this medication is causing you to be too groggy, back off of it and call your surgeon's office. Ice will be one of your very best friends after joint replacement. For the first 2 to 4 weeks after surgery, use ice at the surgical site at least 4 to 5 times a day for 30 to 45 minutes. This will help manage the natural swelling and discomfort as you heal after surgery. Most people use the ice more than the minimum in the beginning. Periodically, get up to take short walks throughout the day around your living room and down the hallway to work some stiffness out as well. You are initially at a higher risk for falls due to the effects of the nerve blocks, new medications, and the surgery that make you unsteady on your feet. To keep you safe, do not get up to stand or walk by yourself. A nurse, support staff, or therapist must always be with you. A family member or friend does not count as a second person while you are here. This will assist us in continuing to monitor your recovery after your surgery and reiterate important safety tips. A gait belt will be placed around your waist whenever you are up walking, so staff have something to hold on to you if you are unsteady. You will need to use a walker whenever you are walking until a therapist clears you to move beyond the walker to a cane. The walker will help you keep steady. Bed and chair alarms will be activated while you are here with us. These are gentle reminders to call the staff whenever you need to get up. Staff will assist you to and from the bathroom. Staff will stay close by you while you use the restroom. We want to be mindful and respectful of your privacy, but trips and falls when getting to the bathroom and when sitting and standing can easily happen in the early part of your recovery. Let staff know if you feel dizzy, lightheaded, weak, or nauseous. These are some normal ways you may feel as you initially recover and can lead to falls. We want to reassess you if you are feeling these things. On average, most patients will stay overnight and discharge home the day after surgery. There are some occasions where a patient may discharge on the day of their surgery, or a patient may need to stay an additional night. This all depends on the discussion you have had with your surgeon prior to your surgery, as well as how you are recovering after your surgery. Physical therapy sees patients on the day of their surgery to complete an evaluation. If your surgery is scheduled later in the day, the evaluation may not occur until the next morning. Physical therapy focuses on exercises specific to your recovery, safety, and being able to go up and down stairs safely. If your surgery is scheduled later, your nurse and support tech will help you at least on the side of the bed or get up in a recliner on the day of your surgery. The morning after surgery, staff will get you up so you can bathe and get dressed in your own clothes. They will also complete morning lab work and make sure you get breakfast ordered. After breakfast, physical therapy will work with you again, as will occupational therapy if your surgeon has ordered it. Occupational therapy focuses on making sure you can complete daily activities like dressing, bathing, getting into and out of the car safely. You may require a second physical therapy session before you discharge. Most patients discharge to their home or to a family member or friend's home. This is the common discharge plan with joint replacement versus going to a rehab facility for a short stay. This is why it is so important to start talking with family and friends about providing some assistance after your surgery. A case manager will meet with you before you discharge to make sure you have a walker and to set up your post-hospital therapy. If you did not have a walker prior to surgery, the case manager can order one and get it delivered to you before you discharge home. Walkers are usually covered by insurance, but there may be a copay depending on your insurance. The case manager will also verify your insurance and talk to you about setting up your therapy. Most patients start with home therapy for at least the first 2 to 3 weeks and then transition to outpatient therapy. In either case, physical therapy will usually see you 2 to 3 times a week. However, it is absolutely vital to your recovery that you continue to perform your therapy exercises at least 2 to 3 times every single day. In the very rare occasion that a short stay in rehab may be needed, the case manager can set this up for you as well. Please reach out to your surgeon's office if you have circumstances that may require a rehab stay. If you are in the surgery center, you will not see case management. Your surgeon's office will set up your therapy. You are ready for discharge when all these things are completed. Your surgeon or their physician's assistant has seen you and cleared you. Therapy, safe with independent ambulation, going up and down stairs, car transfers, basic daily care, hip precautions if you have them. Medical team has seen you and you're medically stable. Case management has your therapy set up and has gotten you a walker if you need one. You have received discharge instructions from your nurse and joint care coordinator. Your ride and support is available to take you home. You will have your first follow-up appointment in your surgeon's office somewhere around 2 weeks. Their office will let you know of the future follow-up appointments that you will have throughout the first year and following years to make sure your new joint is doing well. Thank you so much for taking some time to listen to this presentation and actively participating in preparing for your surgery. If you have any questions about this information or information provided in our other videos, please reach out to your surgeon's office or your site's joint care coordinator.